to Back to Basics series by StudyMEDIC for your upcoming MRCOG Part 3 exams. This is Dr. Priyadarshini, one of the mentors with StudyMEDIC, and today we are going to discuss on the module Early Pregnancy. I have taken up Alport syndrome and I'm going to give you all 3 different scenarios in which Alport syndrome can be tested in the upcoming exams. We are going to discuss SPT, a patient-stimulated task on Alport syndrome, where you have a lady in booking visit in an early pregnancy. We also have a structured discussion on Alport syndrome. And we also have another patient-stimulated task where we have a lady of Alport syndrome with renal impairment. So these are 3 different scenarios, all revolving around the topic of Alport syndrome. So the exam has a 2 minute of candidate instructions where you're going to read it, and you have a 10 minutes to perform the station. So in the candidate instructions, what are the key points that you're going to look at? First thing, you understand whether it is a structured discussion or whether it's a patient-stimulated task. Secondly, you need to understand what is the domains that are being tested here. So for this particular scenario, if you see, who am I? I am the ST5. Where am I present? I'm present in the early pregnancy assessment unit. This is the first detail that I have gathered from the candidate instructions. Next, I have the information about my patient. A 26-year-old woman, 7 weeks gestation with an intrauterine pregnancy with a history of Alport syndrome. And she is worried about the implications of a kidney condition on the pregnancy. She is very anxious. So I already have a mindset to understand what my role players is going to be like. It's also given some key important findings like you're not required to perform a physical examination. So I can go ahead with explaining the Alport syndrome. I definitely have more time for that. And we have 10 minutes for the tasks. Well, for all the tasks, we have 10 minutes for performance. So what are the domains that are going to be tested here? I will be assessed on information gathering, patient safety, communication with patient, and applied clinical knowledge. So there are 4 different domains given for that. So what is my key performance indicator that I'll be looking at here? First thing is I am going to have a plan or an agenda set before I enter the station. I understand that it's going to be a patient-stimulated task. I have a very anxious patient with Alport syndrome in early pregnancy, and my task is to explain and clear her doubts about Alport syndrome and how this is going to affect her pregnancy and the baby. So the most important thing that we need to understand here is all the role players will also be given a script that they need to follow. In the script, the role players' key information is going to be provided to them. The name, the age, about the obstetric history, the past history, the medical history, all the pertaining information will be there with the role player. And not only that, the role player will also be instructed as to how to act and what is the mood going to be like. So if you get an angry patient or if you get a difficult patient, do not worry. The role play is just acting according to the script that's being provided to them. And also only the information that is provided to them will be shared by them too. So please do not worry if the role player is not giving you certain amount of information. All you have to do to take a good history is to have a standard set pro forma based on which you can ask particular history to the patient. And also, many a times, the role player will be given instructions that the history will be provided, or the role player can tell the history to the candidate if he finds the candidate to be very empathetic, if they find the discussion to be very confidential, and if only the role player has good faith and has built a good rapport. So all these are key factors that you need to keep in mind before you start your history taking. Do not take it to be very light that as soon as you go without assessing the mental standard of the role player, you cannot just shoot in questions. So always have this in mind, have a formal introduction, and then you start off with your questions to the role player. And whatever the role player is telling you, try to acknowledge it. If you have to feel sorry, please bring it out in your body language and also do express it out to the role player. So these are all the role player instructions. If you see, there's a lot of information that are being provided to the role player. So once you have done all that, I've also given you some guidance in the notes. And this is basically for you to understand the role player is going to be emotionally open. And also they are going to definitely ask you 1 or 2 concerns. So what do you infer out of this? The entire 10 minutes of the station is not dedicated for you. The role player also has important role here. They are definitely going to ask you questions. So have it like a good conversation and involve the role player as much as possible. Even when you're going out of track, it is the role player who can bring you back in track for the particular station. So how do we go about with this particular station? Say, for example, you go and you greet the patient. Hello, I'm Dr. Priya. May I know your name and age, please? You need to confirm her name and age. That is very important in maintaining your introduction and also in your rapport building. And since she's pregnant, you can express, congratulations on your pregnancy. How are you feeling about it? Do not go and immediately start. Yes, I know you have Alport syndrome. So first you acknowledge that yes, she's pregnant. So give her a congratulatory message and ask her how she's feeling. Is she having any symptoms of vomiting or anything? Is she comfortable to speak now? So all that is definitely going to build in a better rapport with the role player. So once that is done, and then you can start with a very basic tone or a very calm tone because she's worried about Alport syndrome. I understand that you have Alport syndrome. And are you having any concerns regarding it? Okay, so you bring in open-ended questions. Do not ask closed-ended questions. Okay, so that's how you are going to start your rapport building with the role player. After that, you have to take a very, very focused history because you know for entire history taking, if you can spend somewhere around 3 to 3.5 minutes, that is a good way so that you will have a lot of time to explain about Alport syndrome and also to explore the concerns of the role player. So in focused medical history, key important factors is to ask about the renal history. Since when has she been diagnosed with it? What is the severity? Is she having any medications for hypertension? So all these are very important factors which are pertaining to Alport syndrome. And then about hearing loss, because that is again very common in Alport syndrome. So why is this important? Because we'll have to rule out if whether she's taking any drugs that are contraindicated in pregnancy. This is going to test on patient safety as well as on your applied clinical knowledge. And also in history taking, you need to understand, you need to ask about the family history, past medical, past surgical, social history, sexual history. All this needs to be covered. And also how is her support and what is her occupation? This is important. And of course, you need to talk to the patient about her concerns. Always try to have an open discussion. So, what is most worrisome for you at the moment? Do you have any questions for me? So you always have a prefixed idea that since she's a case of Alport syndrome, she'll be more worried about whether this is going to spread to the baby. So always keep your mind ready with all the answers that are going to be asked, questions to be asked around inheritance, the miscarriage, the baby's health, the risk of the fetus. So these are some important things that you really need to revise and keep it so that you explore her concerns and also give appropriate answers. And whenever you're trying to explain about Alport syndrome, you need to talk about both the maternal risk and the fetal risk. Okay. Of course, whenever you're starting to talk about a risk factor, you try and encourage her and make her understand that yes, we are, a group of MDT will be available there. The consultant will be available there. All these doctors are going to take care of you. This kind of reassures the women before you point out to all the risk factors, because that might be a bit scary for the women also. So one thing is you make her feel comfortable about being pregnant with the Alport syndrome, and later on you put in all the risk factors and tell that we are going to be keenly observing you and also testing you timely to understand if you or the baby is going to develop any kind of risk factors here. Okay, so you need to tell this and you have to tell her that it is definitely a high risk pregnancy, but still manageable. We have seen many women like this, and you will definitely be under a good care with us. Okay, you tell about all that. And then genetic counseling is very important in Alport syndrome. You need to explain that it is an X-linked or an autosomal depending on the mutation. So whatever is the mutation, you need to explain that very, very clearly. The chance of passing it to the offspring can be 50%. Okay, it can be very severely, suppose if it is an X-linked disease. And the genetic team will definitely be involved in it if she's asking for more explanation on the genetic part also. And when you're explaining about the genetic counseling, keep in mind to avoid a lot of jargons. All the information that you are telling the role player needs to be well understood by the role player. That is a key factor that you need to keep in mind. So always have some key words in your mind whenever you're talking about genetic counseling. Keep yourself prepared for this. Next is about the medication review. You need to ask, are you taking any medicines for your kidneys or for your blood pressure? Okay. And if she's going to tell yes, you need to ask her whether she knows the name of the medicines. Suppose she say no, you need to tell her there are some medicines which we use for control of hypertension, which are contraindicated in pregnancy. Well, if you do not know the names, I would try to see and see if it's available in any of your records. Else, you need to come back and let us know what other medications you're taking on so that we can switch over you to some safe medicines in pregnancy. Do you understand? Is it clear? So always put in terminologies like this in between whenever you give a piece of information. So the best way of giving an information is to provide it in chunks. Do not speak paragraphs together. Give an information, test for understanding, explore the concerns. Next, go on to give the next set of information. This is how you pass on information. And of course, you need to talk about the planning in the pregnancy. You are going to be a high risk antenatal woman. You're going to have a multidisciplinary care with your maternal medicine team, your nephrology. The renal functions are going to be tested. The baseline as well as the follow-up is going to be done because it's a very high chance of renal deterioration. The growth scans will be targeted right from the mid-trimester onwards. And of course, you're going to have frequent checkup of your renal function. So all these are important in pregnancy planning and surveillance because you need to talk about how our entire pregnancy is going to be. Sometimes if you have a case and you think you need to talk about antenatal, intrapartum and postpartum care to the women, you can start by saying, yes, I'm going to give you a lot of information about how this pregnancy is going to be and how your delivery care is going to be, and also post-delivery, the care of you and the newborn. Today, let me talk about the antenatal care or the entire care in your pregnancy. Is that all right? In our subsequent follow-ups, we can talk more about the delivery care plan and the postnatal care plan. Is that all right with you? You can give in a general sentence like that. So even if you're running out of time, the examiner is clear that you need to give all these information to the woman. Lastly, you always remember that you need to reassure and support the woman. Just because she's got Alport syndrome, you need to validate all her concerns. Because she's anxious, like, yeah, it's completely natural to feel anxious. Okay, so do not say, okay, why are you anxious? Don't ask some very basic or bland questions. Always try to validate her concerns. Well, let it be anxiety, let it be worry, let it be cry. Always try to validate it. And at the end of history taking, it's always a good idea to summarize the history to the role player just to ensure that you haven't missed on some key vital points which can help you in the management. Okay, and always remember that whatever information you get, you need to re-emphasize on giving her or providing her with written materials, some contact numbers, and also provide her with follow-up booking with your consultant or the multidisciplinary care plan. So this is how you're going to complete or give a closure to your station. So always starting of the station and end of the station, you need to really provide her a complete closure. Okay. Like however you start, you need to start in a very good tone and maintain a good rapport. So try to maintain that same towards the end also and give a closure. These are some key vital points on how the consultation can go in this particular station. Now, giving you so much of information, what are the key factors that are going to tell you whether you're going to clear the station or whether you're not going to clear the station? Well, we all are hoping for you to clear the station, but let's also take a look into the key points that can aid you in clearing the station. So domain ways, if you're going to look here, information gathering, whenever you're going to take the history of Alport diagnosis, no, you've already made the diagnosis already been provided in the candidate instructions. So how well are you going to take the history and understand the importance of renal involvement there? Medications, very, very important. The family history and the inheritance, and also to look at other features. It is not only the renal involvement, you also need to talk about hearing loss, other systemic signs, her emotional concerns. All this are going to give you some marks here. With communication, as I was mentioning, empathy, rapport, and avoidance of jargons. These are three important things you need to keep in mind. Apart from that, encouraging the women and exploring her concerns are definitely going to add on marks for this. In applied clinical knowledge, you need to give a structured idea about how the baby and how the mother are going to be affected because of Alport syndromes. So you need to talk about the risk factors. And the medications are going to be they're going to play a very crucial role, especially in early pregnancy, and the involvement of your MDT. All these are key factors which can give you a mark in your applied clinical knowledge. Coming to patient safety, once again, it's about the teratogenic drugs and how I am going to change it. Correct identification of the patient, just in case she has any reports that are carried with her, and your MDT of how we are going to refer her, and the genetic involvement. Antenatal surveillance, who are our emergency contacts, all this need to be done. And at the end, you have to give her a clear follow-up plan of what next she is going to do. All these are going to be marked for your patient safety domain. So this is the domain-wise marking of all the station of this particular station for all the domains. Now, what are the key points that can aid you to pass this station? Of course, once you finish the station, there is something called as the global scoring, which the examiner feels that yes, this candidate is fit to clear the MRCOG Part 3 exam or no. That is called as the global scoring. For your global scoring to be well, main thing is you need to be a safe doctor, you need to be a confident doctor. This confidence can come in the way you talk, the way you look, the way you dress up for the exam in a very formal way, and also how well you're maintaining your body language. All these are key factors for you to keep in mind before you go for the exams. Now, let's look into some key points that can help you clear the station. One thing is always demonstrate empathy and give structured explanations. Try to use references whenever possible. And what are the key factors? What are the key risk factors? That is what you are expected to talk here. You're not expected to talk all the theory that you know about Alport syndrome. Remember, it is not a structured discussion. It is a patient-stimulated task that we are doing here. MDT makes you a safe doctor, and also whenever you're not sure of any question the role player has asked, you can always say yes, the MDT will take care of it. So these are some additional tips which can help you to build your confidence in this particular station. And always you need to give her realistic reassurance. You cannot tell her, yes, just because you're there with me or there with my team of doctors, everything is going to be fine. No, Alport syndrome is definitely the pathology is already there. So definitely it's going to have the women into the high risk category, and definitely it is going to pose some risk to the mother and the baby. So always whenever you're reassuring, you need to tell her, yes, this is a high risk case. However, a team of doctors will work appropriately to give you adequate care so that your complications can be identified at the earliest and you can be treated appropriately. Okay, genetic implications is important because it's a genetically inherited disease. So all these points, if you're going to emphasize again and again, then this station is going to be a clear pass. However, there are some important areas that I would like to highlight for you guys, which can be mark detecting points. Now, when you're not going to ask about the severity of the Alport syndrome, yes, I know you have Alport syndrome and you're done with it. No, you need to ask about how severe the disease is, because that's going to be a key role factor of how the pregnancy is going to be. If she's already in severe renal impairment and she's pregnant also, then obviously she's going to be in a very high risk. Okay, the severity and history is very important here. Current medications, many of the times we see that the medication history is completely missed in Alport syndrome. Well, that's going to give you a lot of negative marking in this, so keep that in mind. Family history and associated symptoms like hearing loss, all this needs to be taken in the information gathering. So what happens when you don't do it, the impact is going to be an incomplete history and a very poor assessment. Now, coming to communication, suppose if you're going to use excessive medical jargons, like how you use in a structured discussion, glomerulonephritis, GFR, this is going to decline. So obviously, those kind of medical jargons, when you're not going to give an explanation, is going to fetch you very low marks. And say, suppose the woman is saying, doctor, I'm really worried about this pregnancy. And you're like, okay, fine. And then you go ahead, then you're not going to get marks for that. When the woman says she is worried, you're expected to acknowledge what she is feeling. Do not be dismissive of what she says and do not have a hurried up tone. It's okay. You need to empathize with the women. Well, that's what we do in our routine clinics, right? You just need to put it here in your station too. And whenever she's anxious, try to acknowledge and validate her anxiety. And do not give her over reassurance, because you know it's a high risk case. So what happens when your communication is not fine? This is going to definitely reduce your rapport building and the patient confidence in you. So once the role player feels that, she's not confident with you, obviously you're not going to take a good history taking and all your explanations are not going to satisfy the role player. So this communication is very, very important here. Coming to applied clinical knowledge, well, you need to understand about Alport syndrome, its progression, its risk factors, and all that. If you're not thorough with the applied clinical knowledge about Alport syndrome, now this is the right time for you to go ahead and read about Alport syndrome. And you need to talk about maternal risk factors, fetal risk factors, and the drugs that you use for Alport syndrome, especially your antihypertensive, needs to be kept in mind. And when you're talking about genetic information, you need to give the correct information to the patient. So patient safety, again, medicines, your MDT and your safe care plan is very, very important. If these points not covered, definitely that is going to put you as a unsafe doctor or a doctor who is not having patient-oriented management plan. So keep that in mind. I hope this patient-stimulated task is going to help you for your upcoming exams. The common pitfalls, medical jargons, current medications, because these are the key factors that we have identified for students or candidates to fail before. And also inheritance pattern and family history is very, very important in this stage. So additional red flags that you need to keep in mind. Whenever the examiner or the role player has an impression that you do not have a particular structure to talk about, you're very uncertain about the information you're putting it across, you're not empathetic towards the role player, and you're not, putting in or tailoring the information as per the understanding level, and also time constraints. So these are some key important red flags that you need to keep in mind. You might know everything about Alport syndrome, but just you haven't delivered it appropriately in the station. Keep that in mind. You're talking to a role player. You're not talking to an examiner or your colleague. So you need to put it across in such a way that the role player gets your information right. So also the examiner will be provided with certain information on which he is going to test your overall performance of how your clinical insight is, the way you're going to communicate, whether you're a safe doctor, your safe practices, and whether you're empathetic. So these are some key points the examiner will also be looking at when you are talking or having your task done with the role player. Now, going on to the next scenario. The next scenario is you are an ST5 doctor and you're present in the preconceptional counseling clinic. You are seeing Mrs. Sarah Matthews, a 28-year-old woman who has Alport syndrome. She's planning to conceive. So this is preconception and she has some concerns. So you are again going to be assessed on information gathering, patient safety, communication, and applied clinical knowledge. So if you see, again, it's 2 minutes of reading time, 10 minutes of performance time. And first you need to understand who you are. You are ST5, where you are in the preconceptional clinic. So these are two things you need to keep in mind. Next, you have the basic information of the patient and also you have the domain list. So as we had discussed in detail for the first scenario, same thing is going to apply here. But understand she's yet not pregnant. Okay. So since she's come to the preconceptional counseling, you still have a lot of time and a lot many things that you can talk and explain to her, and also to have a baseline evaluation before she starts pregnancy. So again, if you see, the role player is very, very concerned. Okay. If you see, the key point the role player has here is she has a borderline high creatinine and she also has mild proteinuria. That means what? She's already got renal impairment. If your history taking is not going to be accurate, you will miss on this factor. Okay. So always keep this in mind. Your information gathering is important to assess the status of the woman right now. So if you see here, because it is a preconceptional clinic, again, you're going to start with, in the information gathering, as mentioned earlier, keeping your basic template, you're going to take a detailed history. Her medication history plays a key important factor and her renal parameters. Because in every station, you do not know what is the hidden agenda that's kept for you. So always take a complete history to have a better understanding of the station. And since it's preconceptional clinic, you also need to talk about her partner, about her fertility status also. Since when is she planning, or whether it's a case of associated subfertility. Okay, you need to look into that aspect also. Applied clinical knowledge, as we saw earlier, we're going to talk about the renal implications in pregnancy, the pregnancy risks for both the mother, the baby, the inheritance pattern, and the genetic counseling. All these play a key vital role wherein your applied clinical knowledge is going to be assessed. In patient safety, you're going to discuss about medications. Medications play a key important role here. And of course, your MDT, referral under a consultant-led care, these are the other factors. So be very simple with the patient. Use very simple terms and use layman terms. Always offer support. You're not going to scare a woman who has come for a preconception clinic. Keep that in mind. Give her assurance about how her pregnancy is going to be, and also tell her, yes, it is a high risk pregnancy. So you need to give her assurance so that she's able to go ahead and plan her pregnancy. You're not going to scare her with all the risk factors that are present with Alport syndrome. And another important thing here is you need to give her referral to a maternal medicine unit. Okay, you tell her that though I have discussed so much with you, you can discuss further in the maternal medicine unit. You can also have a visit with your nephrologist to have a review of how your renal functions are before you plan for your pregnancy. Involve the genetic counselor also here, because the genetic counselor will definitely be in a better position to talk about genetically inherited disease. So you tell her about how the genetic inheritance goes on with Alport syndrome, and then you can refer her to the MDT. This will give you additional marks definitely in this stage. So how are you going to start your consultation? Of course, you're going to start with an opening statement by introducing yourself and also get a basic idea about the role player. And then you set an agenda and tell, what can I know your main concerns today, or what are your main concerns today? Okay. And make sure it is preconceptional. And then, of course, you're going to take a detailed targeted history. As I told, you can follow the template because you're not going to miss on any point. And once you take the history, it's always a good idea to summarize it back to the role player just with the key important points. And then you can go ahead with talking about Alport syndrome, her medication history, her genetic history, and her MDT, and your maternal medicine team there. Okay, so all these are very important. Genetic counseling, once again, I'm putting in a word on genetic counseling here. It is very important with Alport syndrome. Go ahead and read about it. So because it's a preconceptional care, you need to talk about the preconceptional optimization about to maintain her baseline renal parameters and the baseline medications that she is taking, and also the need to start folic acid and aspirin. Of course, your MDT is going to come there. And whenever you're passing in information, you need to remember that all information that you are giving the role player might not be beneficial to her. So always stop in between and ask her, is there anything else that you want me to address? Is there anything specific that you want me to talk about? Okay. So asking her and exploring her concerns are definitely going to help you get better marks and to clear the station. So responding to her questions and concerns are very important. It is not that all the information that you have in your mind need to come out in the station. You need to tailor make your station according to the concerns of the role player. So please keep that in mind. And at the end, you're going to give her closure by telling her thank you for the consultation. And I really appreciate that you have come in today to have a detailed discussion before you plan for your pregnancy. And I will refer you to so and so. And also I will give you some information leaflets. You can definitely come up again, once again, if you have any further queries. Hope I've answered all your questions and wishing you all the best to have a healthy and a happy pregnancy. Okay, you can tell something like that and you can give a closure to the station. So again, the common pitfalls that people can go wrong here is about the genetic implications. When you're talking about Alport syndrome, you need to be explaining it in a very simple terms. Okay, if you're not going to offer them genetic counseling, then definitely you're going to lose a lot of marks because it's a preconceptional unit also. And medication history, you need to give a lot of importance to that. And the hidden agenda here is she's got renal impairment. If you're not going to pick up renal impairment here, then again, you're going to lose in a lot of marks here. Okay. And you have to tell her preconceptually, it's always a good idea to optimize her health before she goes in for pregnancy. That's another key factor that you can, you're not supposed to miss in this station. Jargons, try to avoid it as much as possible. Say, for example, you are not able to avoid a jargon. What can you do? You have just uttered a word. Okay, say you have just uttered something and you want to clear it. So how can you clear it? You can just give an explanation of what you have told. In medical terms, it is so, but in layman terms, this is the explanation. Like say a nephrologist you have told and she's wondering, nephrologist? Then you can tell, yes, he is a doctor who looks into the kidneys. Okay, so just give an explanation of what you have telling also, so that that gives a better and a clearer explanation to the patient. So going ahead with the last station. Now this is a structured discussion. Now what is the key difference here? You have your examiner. Examiner is going to ask you questions. So it is easy for you to just sit back, relax and answer to the questions. But again, there are some key catches here in this station, which you might get wrong. So let us see how we go ahead here. Here again in the candidate instruction, if you see, who are you? You are an ST5 doctor. Where are you? You are present in the maternal medicine clinic and you are visiting a particular patient. They've given you the patient details also. And it is mentioned you have 10 minutes for detailed discussion with the examiner. So you understand that this is a structured discussion. Okay. So what are the key important things in structured discussion? Again, you need to prepare yourself in the 2 minutes, set an agenda of what probable questions can come. Have a short review of your memory of what all you have read about Alport syndrome. You have only 10 minutes. Okay. You might know pages and pages about Alport syndrome, but you need to put it across in the 10 minutes. So what is the best way to go ahead with the station is to answer specifically to the questions that are being asked to you. Do not sit and answer everything. If the examiner is asking you about key points in history taking, do not sit and talk about investigations and management. Okay, definitely you're not going to get marks for it. Instead, you will be wasting a lot of time by giving in answers that are irrelevant. Okay, so keep that in mind. Second important thing, from the word structured discussion, what you have to pick up is the structure. So always give structured answers to the questions that are asked to you. Make sure that you're giving very crisp answers instead of just beating around the bush and giving in essays or paragraphs, because that is not expected out of you. And time management is very, very important. So I will say ideally for every question that you are being asked, try to spend a minute or so. So say in case you have 8 questions, you have 8 minutes to answer the questions. And of course, the examiner is going to take 1 minute. So by 9 minutes, you will be able to complete the scenario. This is just an example. You never know how many questions the examiner has, but definitely you cannot expect more than 10 questions in structured discussion. So always keep that in mind. So here, if say for example, the question is, what are the clinical concerns in this patient with Alport syndrome? So you can start that. I would like to summarize this case, and you can give an S-bar summary of the patient, and then you can bring in the clinical concerns. Okay. What are the baseline investigations required? So you're only going to talk about the baseline investigations required for this particular patient. Okay. You're not going to generalize. You're going to talk about the patient and about the Alport syndrome she has got. So these these questions are definitely under the domain of information gathering. Okay. So again, the marking is going to be domain based. The questions will be kept in such a way that all the domains are being tested here. On applied clinical knowledge, they can talk you about, they can ask you about the management of this patient in the antenatal period. They can talk to you about the delivery considerations. So whatever that is being asked here, just ensure that you are sticking to the question that is being asked to you. And how are you going to counsel the patient regarding the genetic implications? Then you can talk about the genetic factors here. Of course, you can be happy that there is not much of jargons that is given importance here, because you're talking to an examiner. He is your colleague. So you can very well use about all the medical terminologies here. What kind of support you'll give, what kind of information you'll provide, and how are you going to reduce it. So always try to understand, if you're asking a question, you need to tailor your question to the particular scenario that is being provided to you, and do not generalize and talk also. Okay. So these are some key points that you keep in mind when you're going in for structured discussion cases. So key tips to clear this particular station: always have a very, very structured counseling. Okay. Do not go haphazardly answering questions. Okay. And always try to use simple language, basic language, and a calm and composed tone is very, very important. Now, what are the key strategies that I can provide you here? Okay. So, whenever you're prepping for this exam, I would say have a very formal way of you presenting yourself in the exam, and always structure it in such a way that you start the first impression you give the examiner of a very good introduction and a rapport building. Let it be the examiner, let it be the role player, let it be a junior, but have a very, very good introduction and your rapport building that really hits off or, clicks the station for you, and have a very structured way of talking to the patient also. Okay, you have to hit the key domains. So always have a good closure to the station also. That's another important thing. You need to plan with her. You need to talk to her. You need to have a shared discussion involving the role player also. Just don't think that because you're the doctor, you're just going to put in all your information or all your ideas there. You cannot be so. Okay. You need to put in the patient also in as an important player there. And it's always a patient-centered care that we are looking at. Next is patient safety. Now, patient safety is given a lot of importance. Whenever there are red flags, you need to look into that. It can be about medications, it can be about allergies, it can be about appropriate referrals. All these are very, very important. And MDT. MDT is given a lot of importance in your exams. Try to bring in MDTs whenever you're preparing yourself outside the cubicle itself. Try and plan an area whether an MDT is required for this case. If yes, put across the word of multidisciplinary team care in your with your examiner or with your role player. That will certainly help you get higher marks. So this term of MDT is very important. Going on next is about empathy. Always have adequate empathy shown towards your role player. Okay. And it's not like you have to sit and say apologize multiple times, but whenever you need to acknowledge a sorrow, whenever you need to acknowledge something, use that. Validate her emotions. This is very, very a key vital point that can help you clear the station. And your knowledge is okay whenever you're using in some reference materials. Okay, try to bring in which is the green, whether you're talking about the green top guidelines or whether you're bringing your nice guidelines, you just give a reference also. That certainly is going to add on to your presentation. That's going to make you a safe doctor. That is going to add on to the value of your applied clinical knowledge. So always keep this in mind also. And time. Whatever I say, you need to understand you have only 10 minutes. Everything is under the bracket of 10 minutes. So keep that in your mind. Use your time very, very judiciously. Okay. Do not waste time here and there. Try to answer appropriately. And at the end of 10 minutes, you need to remember the station is done and you're entering the next cubicle. So forget whatever you have done in the next 10 minutes and go ahead with a fresh start to your next station, because you never know, the station that you feel you haven't done well might be the one that is going to get you the best marks also. So always keep that in mind. Even if one station is not going to go so well, do not worry. You have your next 10 minutes. Always have that attitude in your mind and carry forward. And at this point, practicing is the best way you can do for yourself. So keep practicing more stations. Have a look at all the videos. That will certainly help you prepare better for the exam. Thank you, and do subscribe to this channel of StudyMEDIC to watch more such videos. Thank you and wish you all the best for your exams.